Hello everyone, welcome to sqadia.com, and in our first section of the lecture topic genitourinary problems, we will talk about sexually transmitted infections. And in this section, we will talk about what are sexually transmitted infections, how the history, how we should take the history of the patient with sexually transmitted infections, and what are some associated conditions. So sexually transmitted infections, also abbreviated as STI and sometimes STD, sexually transmitted diseases, and then also venereal diseases. Venereal diseases is the other term used for sexually transmitted diseases. Usually they are asymptomatic. Asymptomatic means no symptoms are present. That's a really bad thing, because when they are asymptomatic, usually the patient is unaware that they have any sexually transmitted infection or disease, and even when there are no symptoms present, patient can spread these infections, so they are transferred or transmitted to other person even when there are no symptoms are present. So diagnosis is really hard of these infections when the symptoms are absent, and these are infections or sexually transmitted infections are more common in young people, and in older people usually they are not as common, and since they are asymptomatic, usually the diagnosis is missed in the older individuals. So taking history, sexual history is important, because whenever the patient is giving the sexual history, usually they are not very comfortable, and the doctors are not very comfortable also when they are asking questions about the sexual history. But this is very important part of the history, and to also rule out if the patient might be at the risk of getting sexually transmitted infection. So always take the patient in ask them that, or tell them the patient that it's okay. Take them in confidence and tell them that there will be totally the answers will be private and nobody will know the answers, but it is important that you should give the clear answer to the questions to rule out any chances of any problems or chances of getting infections. So in the history, the assessment of clinical need and symptoms are important. Ask the patients if they have any symptoms like any foul smelling discharges, any history, any vaginal discharge, itching, dysuria, pain on intercourse. These are some common symptoms you need to ask the patient if they have these symptoms, or if they need any further assessment, or if they need any further help. Ask them why they are there or why they want to see the doctor. So this is all very important. Then sexual and other exposure to guide testing decision. Ask them if they are sexually active, if they have any new sexual partner in the last 3 months. So this is also very important. What's the frequency of the sexual intercourse, what type of intercourse or what type of sexual activity they are involved in. This is again very important to know. Contraception need and pregnancy risk assessment. Ask them if they for this it's important to ask their last menstrual period, last day of the menstrual cycle. So if there are any chances that they might be pregnant, then pregnancy test should be done if the cycle is delayed, or ask them if they want some contraception contraception, because it's better to use the contraceptive methods, especially like condoms, while if they are sexually active or if they have multiple sexual partners. Then other sexual health needs. Other sexual health needs, ask them if they are, besides the sexual contact, or besides the sexual besides the sexual history, other health problems, like ask them if they are involved in some kind of drug use, IV drugs, or other recreational drugs, or if they have any smoking history, any alcohol abuse history. So besides the sexual history, these questions are also important, that can lead to different infections or diseases. Then assessment of risk behavior, open to health promotion, same like any other health issues and other drug uses or IV drug uses is important to ask. And then assessment of exploitation. This is again very, very important question to ask. If they are forced to have sexual contact, or if they have some ex-boyfriend or ex-husband who is trying to blackmail them to have sexual involvement, that's important. Or if they are abused by any family member, these type of questions are also very important. So basically, in the sexual history, ask the sexual history in the regular routine checkup of the patient is important to reach the conclusion if there might be any chances of getting sexually transmitted infections. Then some common testing for sexually transmitted infections and some associated diseases. If there are chances of bacterial vaginosis, very, very common cause of vaginal discharge, bacterial vaginosis. So when this is suspected, usually microscopic examination of vaginal discharge is done, or AMSL criteria. AMSL criteria is the criteria which, in case of bacterial vaginosis, there is usually foul-smelling fishy discharge. There are clue cells seen on microscopic examination of the discharge. There is homogeneous off-white discharge also, and there is these are some very common findings in patient with bacterial vaginosis, and AMSL criteria is to find out those different criterias. And not required if patient is asymptomatic. Usually if there is no symptoms, then AMSL criteria or microscopic examination is not required. Then the other condition is candidiasis. Candidiasis is a fungal infection caused by Candida albicans. This is also the test done is microscopic examination of the vaginal discharge, and also sometime culture is also helpful. Then chlamydia for chlamydia NAAT test is done for vulvovaginal swab. There is discharge removed from the vagina with the help of the swab. And then NAAT test, NAAT stands for nucleic acid amplification test. So it's a molecular test done to find the chlamydia infection. It's a very good test and very effective, 95% accuracy. Then gonorrhea is also tested by NAAT testing, and culture is also done if the test is positive. HIV is serology is done. Serology is the testing of the serum. Serum is one thing you should know is serum and plasma. What's the difference between serum and plasma? Plasma is the fresh portion of the blood, fresh liquid portion of the fresh blood, and serum is the liquid portion of the clotted blood. So once the blood is clotted, the yellowish portion that is removed from that clotted blood is the serum, and serology is the test done on the serum. So serology testing is done for HIV-1 and HIV-2, which gives the level of antibodies present. And syphilis is also detected by serology test done on the serum for Treponema pallidum. And then hepatitis B and hepatitis C is also diagnosed by the serology testing for hepatitis B and C antibodies, and these antibodies present on the surface. So these are different tests done for different STIs and other associated conditions. So this was all about the section 1 of genitourinary problem, in which we talked about the history taking, introduction, and different tests done for STI. Thank you for watching sqadia.com.